Have you ever wondered why we snore? It's a question that has puzzled many. Snoring, a common occurrence in bedrooms across the globe, is often brushed off as merely an annoyance. Yet it may be more than just a nighttime disturbance. Persistent snoring can sometimes signal underlying health concerns. So it's crucial to understand why we snore, the potential complications it may bring, and how we can prevent it. Let's delve into what causes snoring. Snoring happens when airflow gets obstructed during sleep. But what causes this obstruction? The simple answer is that various factors come into play. Let's explore them one by one. Firstly, we have obstructed nasal airways. This could be due to congestion from allergies, sinus infections, or even nasal deformities. These conditions can narrow your nasal passages, making it harder for you to breathe properly when you're asleep. Secondly, there's throat muscle weakness. If the muscles in your throat and tongue are weak, they might collapse into your airway, obstructing the airflow and causing you to snore. Next, we have excessive weight. Carrying extra weight, particularly around the neck, can put pressure on your airway, increasing the likelihood of snoring. Sleep position also plays a role. If you tend to sleep on your back, your tongue and soft throat tissues can collapse backward, obstructing your airflow and leading to snoring. Alcohol and sedatives are another contributing factor. These substances can relax the muscles in your throat, which can cause you to snore more. Smoking is also a culprit. It can irritate your throat and nasal passages, leading to inflammation and congestion that might contribute to snoring. Finally, there are certain anatomical factors. Enlarged tonsils, a deviated septum, or a large uvula can all contribute to snoring. So, as you can see, snoring is a complex issue with multiple potential causes. It's not just about sleeping deeply or being a loud sleeper. There are physiological and lifestyle factors at play that can lead to that disruptive noise at night. Understanding these causes is the first step to managing snoring. It's important to remember that while occasional snoring is usually not a cause for concern, chronic heavy snoring may be a sign of a more serious condition like sleep apnea. Now that we understand the causes, let's move to the possible complications of snoring. While occasional snoring is usually harmless, chronic snoring can lead to various health complications. Let's delve into the potential issues that persistent snoring can cause. Primarily, snoring can disrupt the sleep of not only the person snoring, but also their sleep partner. This interruption can lead to daytime fatigue, irritability, and decreased cognitive function. In essence, the constant noise can turn your serene night's sleep into a series of frustrating disruptions, leaving you tired and cranky the next day. Next, we have something a bit more serious. Chronic snoring could be a symptom of a condition known as obstructive sleep apnea, or OSA. This is a severe sleep disorder characterized by repeated episodes of complete or partial obstruction of the upper airway during sleep. Now, why is this a problem? OSA is often associated with an increased risk of cardiovascular problems, hypertension, and stroke. So, while you may think of snoring as just an annoying nighttime habit, it could be a sign of something far more concerning. Additionally, snoring can reduce the quality of your sleep. You might not realize it, but persistent snoring can lead to fragmented sleep patterns and decreased overall sleep duration. This means that even if you're spending 8 hours in bed, you might not be getting the full benefits of a good night's sleep. Over time, this can have a significant impact on your overall health and well-being. Finally, there's the issue of daytime fatigue. Chronic snoring can result in daytime sleepiness, decreased concentration, and impaired performance at work or school. This is because your body isn't getting the rest it needs to function optimally. Think about it. If you're not sleeping well at night, how can you expect to perform at your best during the day? In conclusion, chronic snoring is more than just a nightly nuisance. It can lead to sleep disruption, potential cardiovascular issues, poor sleep quality, and daytime fatigue. But don't worry, there are ways to prevent or reduce snoring. Let's explore some of these in our next segment. While eliminating snoring entirely may not be possible, several strategies can help reduce its frequency and severity. First and foremost, maintaining a healthy weight is key. Excess weight, particularly around the neck, can put pressure on the airway and contribute to snoring. Regular exercise and a balanced diet can help you shed those extra pounds and reduce the fatty tissues around the neck, leading to less snoring. Secondly, consider your sleep position. If you're a back sleeper, you might want to switch things up a bit. Sleeping on your back can cause the tongue and soft tissues of the throat to collapse backward, obstructing airflow and leading to snoring. try sleeping on your side instead, or use specially designed pillows to help maintain a snore-free sleep position. Thirdly, keep an eye on your alcohol and sedative intake. These substances can relax the muscles in your throat, leading to increased snoring. Try to limit your consumption of alcohol and avoid taking sedatives before bedtime, as they can make snoring worse. Next, let's talk about nasal congestion. If you're prone to allergies or sinus issues, these could be contributing to your snoring. Congestion can narrow the nasal passages and make it harder to breathe properly during sleep. Over-the-counter or prescription medications can help manage these conditions, and using a humidifier can also keep your nasal passages clear, reducing snoring. Moreover, smoking irritates the throat and nasal passages, causing inflammation and congestion that can contribute to snoring. So if you're a smoker, quitting could be a win-win for both your overall health and your snoring. Lastly, consider seeking medical advice if your snoring persists despite these lifestyle changes. In some cases, snoring can be a symptom of a more serious condition like sleep apnea, and it's important to get a proper diagnosis and treatment. Treatment and management of snoring. Pharmaceutical and non-pharmaceutical approaches. ***. Snoring can be managed through a variety of pharmaceutical and non-pharmaceutical approaches depending on the underlying causes and severity of the condition. Here's an overview of both types of treatments. Pharmaceutical treatments. Nasal decongestants. Over-the-counter nasal decongestants can help reduce nasal congestion and inflammation, improving airflow through the nasal passages, and reducing snoring. Nasal steroid sprays. Prescription or over-the-counter nasal steroid sprays can help reduce inflammation in the nasal passages, making it easier to breathe and decreasing snoring. Oral decongestants. Oral decongestants, such as pseudoephedrine, can help relieve nasal congestion and reduce snoring by shrinking swollen nasal tissues. Oral appliances. Certain oral appliances, such as mandibular advancement devices, MADs, or tongue-retaining devices, can help keep the airway open during sleep, reducing snoring. These devices are custom-fitted by a dentist or orthodontist. Antihistamines. In cases where allergies contribute to snoring, antihistamine medications may be prescribed to reduce allergy symptoms and nasal congestion, thereby decreasing snoring. Continuous positive airway pressure, CPAP. For individuals with obstructive sleep apnea, OSA, CPAP therapy may be recommended. CPAP involves wearing a mask connected to a machine that delivers a continuous flow of air to keep the airway open during sleep, reducing snoring and improving oxygen levels. Surgery. In cases where snoring is caused by anatomical abnormalities such as enlarged tonsils, a deviated septum, or excessive tissue in the throat, surgical interventions may be considered. Surgical options include uvulopalatopharyngoplasty, UPP, septoplasty, tonsillectomy, or tongue reduction surgery. Non-pharmaceutical treatments, lifestyle modifications. Making lifestyle changes such as losing weight, quitting smoking, and avoiding alcohol and sedatives before bedtime can help reduce snoring by addressing underlying risk factors. Sleep positioning. Sleeping on one side instead of the back can help prevent the collapse of the throat tissues and reduce snoring. Some people find using specialized pillows or positional therapy devices helpful in maintaining side sleeping positions. Nasal dilators and strips. Nasal dilators or adhesive nasal strips can help open the nasal passages, improving airflow and reducing snoring. These devices are available over the counter and can be used as a non-invasive option for managing snoring. Throat exercises. Performing regular throat exercises, such as singing or playing certain wind instruments, can help strengthen the muscles of the throat and palate, reducing the likelihood of snoring. Behavioral therapy. Cognitive behavioral therapy, CBT, or other behavioral interventions can help individuals address any underlying anxiety or stress-related sleep disturbances that may contribute to snoring. It's important to consult a healthcare professional before starting any treatment regimen for snoring, especially if snoring is accompanied by symptoms of sleep apnea or other underlying health conditions. A healthcare provider can help determine the most appropriate treatment approach based on individual circumstances and medical history. Remember, understanding the causes and complications of snoring is the first step to managing it effectively.